Good afternoon, friends. Welcome to the 5th Biennial Middle East Neuro-Oncology Conference. I want to applaud the chair of this conference, Dr. Fadlo R, for his persistence in making sure this meeting comes together every other year, with its major focus being to improve care for people with brain and central nervous system tumors throughout the Middle East region. While the conference is rooted in the Middle East, it's connected globally. It brings together research, clinical practice, and health policy to make true progress for our patients. It also brings together people from a broad background of specialties: neuro-oncologists, neurosurgeons, radiation oncologists, medical oncologists, radiologists, pathologists, neurologists, palliative care physicians and therapists, rehabilitation medicine specialists, nurses, and pharmacists. It includes researchers, young doctors, senior scholars, patient advocates, health leaders, and partners from across industry. Everyone has a voice here, and everyone plays a role in the patient journey, and they're all part of this conversation. What makes this difference is it's not positioned simply as another scientific meeting, but it's focused on challenges unique to this region, whether genetics, access to care, patient needs, or keeping pace with international standards with their ever-increasing cost and complexity. We hope that you will leave with practical tools, shared guidelines, care pathways, joint projects, and a conviction that you are making progress for the greater good of patients with brain and CNS tumors. The pillars of the program are state-of-the-art science, including genetics, AI and imaging, liquid biopsies, standard of care in terms of surgery, radiation, systemic therapy, clinical trials. All of this is grounded in patient-centric care that includes every member of the care team. And there's a special track for nurses and pharmacists with practical tools for their professions. The outcomes are ambitious: shared guidelines and care pathways across centers, a regional registry and trial-ready network, training and mentorship for the next generation of young colleagues, and ultimately, of course, better patient outcomes, earlier diagnosis, better care, better access to care, and better quality of life. It's imperative that this move forward and that it continue to grow. After all, brain tumor cases are rising, but patients are living longer with more long-term challenges. However, treatments are advancing quickly. It's critical for this region to generate and share its own data, not just import it. That's why I give a big shout out to the program committee, to the chair, Dr. Ossi, to all the committees, institutions, faculty, and sponsors, and especially to our patients and families. Your strength is the inspiration and the reason that we do this work at AUBMC and beyond. Thank you.